Hello. Yeah, so John, where are you based currently?
So I'm just outside Cambridge.
Okay.
Yeah, so someone's got some speakers on. And yeah, so sort of probably, yeah, the office is maybe 10 minutes outside of Cambridge, maybe 15. Yeah, so it's really good. And what about you?
Yeah, so that's great. I'm in Mumbai.
Oh, nice.
Yeah, financial capital of India. So
Yes.
yeah, Mumbai is usually humid. So, yeah, but it's a good day today.
Oh, that's not too bad. What time is it in Mumbai at the moment?
Yeah, we'll be soon approaching at 6:30 p.m. evening.
So quite late for you guys.
Yeah, it is.
Yeah. And what is it you do?
Yeah, so I'm into intellectual property rights.
Okay.
Yeah, I specialize in patents and working here with Photon Legal. So I've been working with Amit and Priyank for more than 6 years now.
Oh, nice.
It's been a great journey.
Yeah, I bet.
Okay, so we have two speakers. May I please request you to turn on your video camera so that we can see you?
Can you hear me, Vaishnavi?
Yes, yes, I can, Dr. Srilata. I can hear you. I'll rename you meanwhile.
This yeah.
Okay, I think you've turned on your video, but I'm not able to see you at the moment.
Yeah.
Is your slide on? Have you got your secret camera slide over?
Yes, it's clicked over. Yes.
Yeah.
Yeah.
Is Ivan here?
Guess not.
Okay.
Hi, everyone.
Yeah, hi Ivan.
Hi.
How are you doing
Hi,
today?
Brian, all right?
Good, thank you. Only three of us?
Yeah, actually, Dr. Srilata has also joined us, but we're not able to see her at the moment. She's joined through audio. So, okay, then all set. Then we can just begin the webinar.
Okay.
Okay. Okay, so hello and a warm welcome to all our webinar attendees who are joining us from across the world. As you all know, Photon Legal has organized a 4-day e-summit, The Future of Health Tech. And yesterday we had a fantastic session, which was moderated by our founding partner, Mr. Amit Kaushal. And today we are at day 2. I have a fantastic and talented panel in front of me. So let me begin by introducing a bit about myself. I'm Vaishnavi Zoshi. I'm working as a senior scientist intellectual property with Photon Legal, and it's been more than 6 years now. So on our panel, we have Ivan. Ivan is the CEO and founder of Demigos Healthcare. So Demigos provides IT solutions for healthcare industries and startups. Ivan Ivan worked as a QA engineer. I think when he probably started his career back in 2011. Then he went on to become a software Android developer, and after that he co-founded a company called as Aliro Trade, which was an international marketplace for agricultural products. After that, he also co-founded another venture, Wendy's Team, which was primarily into elderly care. And presently, he's the founder and CEO of Demigos Healthcare. So that's been quite a long journey, Ivan. We would like to know more about your journey. Meanwhile, welcome to our session. Look forward to hear more from you.
Thank you. Thank you for having me.
Yeah. Another guest on our panel today is Dr. Srilata. So she is a passionate clinician. She's been practicing in critical healthcare for more than 14 years now. And we can all imagine what these pandemic years must have been for her. So we'll know more about her. She has also been trained into anesthesiology and advanced management for healthcare. And she's presently based in Hyderabad. And most recent achievement, she's become inventor, and she's invented something really interesting and helpful for the medical world. We'll know more about it shortly. So thank you for joining us, Dr. Srilata.
Thank you for having me, Vaishnavi. I'm very pleased and very honored to be here with this team.
Yeah, same here. So allow me to introduce our final panelist for today, John Dibb. So John is a digital innovator. He is passionate about promoting long-term health and well-being solutions. Currently, he's the Joint Chief Executive at Priority Digital Health, which is an award-winning enterprise. Their goal is to standardize healthcare, erase healthcare inequalities, deliver real system change, and cost benefits. Previous to this, John has also been through quite a long journey. He was an e-com specialist working for big brands like Wallace and Ferrari. Then being an entrepreneur at heart in Gibraltar, he founded a company called as JD Solutions, which was a digital agency. And after that, he again returned to the United Kingdom and founded Consultancy 13, which was a digital transformation consultancy, which led to formation of his present company, PDH. So we're thrilled to have you on board, John. Look forward to hear more from you.
Thank you. It's thrilling to be here as well.
Yeah, perfect. So yeah, with all the introductions, let's begin our today's session. And I would like to ask my first question to Dr. Srilata. So Dr. Srilata also happens to be a client. We recently helped her in patent protecting her innovation. So Doctor, please tell me a bit more about your journey. We've all seen how dedicatedly and selflessly doctors have stood by us. So a big thank you from all of us, first of all. And so how does it feel to have reached this point in your career?
So Thank you for whatever you have been saying about the doctors, but yeah, this point in career is just a point in the journey. It's been a very interesting journey. I started it about more than 10 years ago, and have been very passionate about bedside medicine. So I have been going along where life takes me. So I was in Bombay for about 4 years, and I've come to Hyderabad as a consultant in critical care. And we are in a tertiary care unit, so we handle all departments of medicine, cases from all departments of medicine. So of course, COVID has put the spotlight on critical care and anesthesia all over the world. And yeah, it's been initially it was quite tough to even fathom what's going to happen in the next few days or few weeks. But from if I think about March 2020 to here, from where we stood in March 2020, we were all very afraid and scared about what was going to happen, not just to us, not just to patients, but the entire health workforce and our immediate population. To now, where we are quite freely moving about, having taken 2 doses of vaccine, and the COVID load has come down a bit, a lot actually. We have only a couple of cases in the unit right now. But more interestingly, it has led me into thinking more about how I can help my immediate workforce, especially nurses and people who work very closely with the patient, in proximity to the patient. And that's how this particular, I can't call it an invention, but it's an innovation on the medical cot that helps patients easily change positions. So this was a breakthrough in my outlook or in my in my life, because I never thought, if 2 years ago somebody told me I would be an entrepreneur sitting in the company of entrepreneurs or tech pioneers in technology and digital technology in healthcare, I would not have believed anyone. So that's how I'm here. And yeah, it's been a very, very interesting journey. I'm very passionate about making life easy for myself and people around me, actually. So that's how this happened to come about. And I hope this is just the start. It's still in the, I must say, it's still gestating. It has to come out as a good baby and grow up in the world. So I hope I can take it forward. And it's a long journey ahead. I'm very excited to come on to this journey. Yeah.
I'm sure, Doctor, we have a long way to go together. And I think necessity is the mother of invention, and that is how you were motivated to do something, to think out of box, and you rightly protected your intellectual property. So really glad to be a part of this, and thank you for sharing this with us. So my similar question is for Ivan. So, Ivan, what motivated you from being a quality analyst to a developer, and now how has the combination of information technology and health sector worked for you so far? You need to unmute yourself.
Excuse me. Yeah, so I always wanted to create products that bring value to people in society, and basically like I'm a fan of technology and how technology can change the world. So we started in healthcare from building a software system for home health for home care company in the US. Wendy's team. So basically, Wendy Ton, a founder of the company, came to us with a request to redesign their iOS app. So she had an idea that if that is so easy to take an Uber drive, why it is so complicated to find a caregiver for elderly parents? So she wanted to build up a service that would help to book such services with the as easy as you do Uber driving. So basically, she had only an iOS app, and then we figured out that the issue not in iOS app itself, but she needs an entire software system, because all the clients and all the caregivers were handled on a piece of paper. So we designed and built the whole system that automates all the operations within a company. So now we have a portal for clients where they can book services, a web application, a web portal, and as well as web portal for caregivers where they can easily set up their schedule and be able to take visits as independently as they can when they have time. So that would that helped company to streamline operations, to scale operations, and take more clients than Wendy could on the piece of paper. So that was an example how we saw how technology can impact and bring value to healthcare. And we started from there. So now we are building different system, like, for example, telemedicine solution for the Kuwait market, or entire AMR system for the home health industry in the US. So now, especially with the COVID, we see more and more in demand in this health tech field, that
certainly.
healthcare field is transforming, and that is, of course, an opportunity.
Yes, couldn't agree more with you, Ivan. John, what would you like to add to what just Ivan said? Because formerly you were into optimizing digital presence for several of your well-known clients, and now suddenly the focus has shifted to telemedicine. You know, if we are to look at the stats, more than 50% of patients now prefer being diagnosed through telephone and not visit the clinics in person. So how has this whole scenario worked out for you?
So very, very similar to what Ivan was just saying, that the shift in COVID has been huge. The changes in digital healthcare from the UK's point of view in the last 18 months has accelerated digital health in primary care and even secondary care faster than anything else that we've seen in healthcare in the UK for decades. And it's only going to get better. We're only at the beginning of that journey. There's still lots of IG and restrictions and technology that still needs to be put into place to make it mainstream. But, you know, patients don't want that. Patients want, like you were saying, patients want to see their GP over Zoom. They want to be able to call their GP and have a video conference or a telephone conference. They don't want to have to traipse all the way into the surgery. Equally, in the UK, we have a massive problem with recruiting and retaining GPs in practice. So whatever we can do from a technology point of view to fast-track diagnosis, to make it easier and faster for patients to access their GPs on a face-to-face basis, I think it's really, really important. And technology is the way forward for that. You know, a GP can see 10 or 15 more patients a day using technology and diagnostic tools. So why shouldn't we be moving it? And here at Priority, we're all about that. We're all about trying to streamline the GP's workload, remove those patients from practice that don't need to be there, that are better served in the community, but also, you know, giving access to patients when they do need to be there. And I think that's a really key point that we need to move forward with in the coming years.
Wonderful. Yes. Dr. Srilata, would you, so all these opinions have been from our side. We do not actually work at grassroots level and, you know, interact with the patients or manage all the healthcare resources. So what do you think the digitization of healthcare, what do you think would be your views on it, and how open are we to accept it as a society?
Oh, we are definitely open to accept it as a society, since we are surrounded by digital media and we are surrounded by machines, and it's all we have a phone in our hand like it's an it's an extension of our body right now. As I myself had faced with digital medicine, e-medicine, and telemedicine quite a bit because of this COVID. By what I understand and my experience with it is that the scale can be achieved quite easily. In the sense, you can go to remote places and you can help people in remote places with the help of technology, and you can diagnose and give at least initial treatment, or help other healthcare workers give treatment, or assist them in diagnosing or treating or managing patients. What I find some difficulty with telemedicine and digital medicine is that we all know the tech that we hold in our hands is not the same with everyone. Like one might hold an Apple phone, and somebody might hold some other phone which the resolution or the technicality of the phone itself, or the transmission, or catching the transmission is not appropriate with some handsets or with some digital equipment. So I found it at times when I was trying to decipher what patients are suffering from, or when I try to examine patients on the phone, or even on my laptop, or through a visual medium. I quite often found that the signs that we see in the presence of a patient are not exactly similar. At least sometimes, I'll give a very common example. We often see the eyes and the tongue to see if somebody is anemic. Let's just say that. So the color of whatever we see is not exactly similar when we see a person and on the phone. Like we can see right now that the clarity of the image is not the same. So that makes a huge difference for us as doctors, or even as nurses who try to examine patients. So these are things that need to be attended to when we want to take it up at the scale is fine, you can reach anywhere, but when we want to really help the patients and not make misdiagnosis or mismanage patients, this is extremely important to take care of, which is not easy, which needs intervention from several different sectors, actually, especially from the government and the regulatory agencies. So it's as a clinician, whenever I ventured into these digital medicine areas where I was treating patients from far, like from some hundreds of kilometers away. These are the concerns that I thought were there, and these are not small. They can make a huge difference to the patient when we take a consult from. I know there are patients who seek advice from, like in India, from US and UK and anywhere, but these are the constraints that at least Indians face. I wouldn't know how Ukraine is or UK is in terms of how the images come about, but in a very normal household setting, if we want to see patients, these things have to be addressed, because if it has to be done properly, I think it's very important for people to take this also up. We are very open to, like, I would love to help patients far away. I would love to take care of patients who are far away, and help at least the workforce who is around the patient. I can help them with some suggestions, or some of the things that we practice here, which are not probably generally practiced there. But these things are quite important. That's what I feel. That's what is my experience, at least.
Yeah, certainly. I mean, there must have been so many challenges and several simulation studies which might be required before we implement the tools and solutions developed by people like Ivan and John, perhaps in our day-to-day life. So, Ivan, in your bio, I read a very interesting thing that you like to make effect or changes which have measurable significance, or the solutions which can help your clients who are healthcare startups to bring about some effects that can be quantifiable and measurable. So why certainly that? And is it like always possible to achieve the right balance between innovation and value addition?
Yeah, that's a good question. I think that, of course, when a company plans to build a solution, of course, they need to determine what kind of impact with that solution they want to achieve. And like quantitative measures is a good instrument to do that, to determine if a product is worthwhile to investment and like if it brings the expected result. So I think that in ideal world, you of course need to determine this parameters, but I understand that when we come up to implementation, some factors can impact that, like, and things like doctor mentioned, that not always the technology brings expected result, but that's what we all try to do, and I think all healthcare companies need to do before they commit to develop a technology project.
Yeah, I think that's a great insight from you, Ivan, and many developing startup industries and companies can think about it. My next question is to John. So, John, particularly at Priority Health Digital, you follow a holistic health approach. And I would like to know a bit more about your approach and how does this work exactly?
So it works for the whole body. We don't believe in treating the physical over the mental or the mental over the physical, because as the doctor I'm sure will say that actually it's all linked. You know, if you sleep well, your mental health gets better. If you do fitness, your mental health gets better. If you don't smoke and you don't drink, you sleep better and therefore your mental health gets better. So it's all about linking, and it's all about looking at an individual as an individual. You know, we're all different. There's four of us sat here in 4 different parts of the world. You know, yes, we're all humans, but actually we're all different. We all eat different food. We all eat different things. Our healthcare should be on a personal level, and digital allows us to do that. And it allows us to share and, you know, create a personal plan for an individual. We believe in telling your story once, and you shouldn't have to go from one healthcare professional to another healthcare professional and start your story all over again. You know, your medical notes and your clinical record and your patient record should go along with you, and therefore giving the clinician the optimum amount of time to spend with that patient, not asking them their last 5 years' history, but actually trying to deal with the concern of the patient at the time. And looking at this holistically is the only way forward for us. We don't believe in, you know, saying that an individual needs X or an individual needs Y. We believe in looking at the individual and then helping the individual create their own plan and their own journey to well-being and better health. And that's where the holistic approach comes in for us. It's a really, really important underlying factor for our whole business.
Wow, that's really interesting, John. And just a follow-up question. So artificial intelligence must have helped you at several stages, I'm sure, during implementation of this holistic approach. So can you share a bit wisdom on that front?
Yeah, so AI is obviously a massive buzzword around the industry at the moment. And, you know, true AI is very hard to come by right now. We don't have all of the capacity. We don't have all of the intelligence built within inside the solution. And, you know, we use actual machine learning rather than AI. And we use a lot of pre-programmed algorithms that are set to deliver a diagnosis. We are not here to replace doctors. We're not here to replace clinicians. We're here to speed up the process of getting an individual to the right clinician at the right time. So, you know, artificial intelligence is a is an area where we stay away from in the most part, simply because we don't, there isn't enough knowledge in healthcare. It's not trusted. It's currently a massive buzzword, especially here in the UK. And I think, in my opinion, most of the people that spout around about AI don't know what AI actually is. Algorithms, they think that's AI. Well, that's just pre-programmed AI. So I think it's a big buzzword at the moment. In years to come, it will become a big player, but right now it's not there.
Okay, perfect. We have a question from audience. So the question is, what are some ways to make people accustomed with AI? John, would you like to take it?
In customs to AI, in what sense? I suppose that's the real question. I think it's about not necessarily trying to get people understanding what AI is. Actually, stop talking about AI and understand what it is you're trying to achieve. If AI plays a part in that in the future, well, it will play a part in it in the future. But I think what you need to be very clear about is, what are you trying to achieve? And before you even get to AI, because it's very expensive, actually, is there ways to get there, to build up your knowledge, build up your understanding before you worry about AI?
Yes, so the secret lies in the basics, and probably if we understand the logics and science behind all the concepts which run around in artificial intelligence, perhaps we may be able to decode it further, is what John has been saying to it. Dr. Srilata, if we were to consider artificial intelligence, particularly in the surgical field, several months before, we read that a robotic hand was used to perform a complete surgery without any human intervention, and it probably was quite successful. So how do you look at such developments in AI? And the good news for you is, John said they are not here to replace human doctors. So considering that fact, what are your views about this?
Okay, robotics has been in place, has been in use quite a bit. We have known that it has been in use for a few years now. Right now, as I read about it, or as I understand it, AI is not going to replace medical specialists, but medical specialists who will adapt and adopt AI and adopt AI into their practices will be better off than those who cannot or will not or do not adapt AI into their practices. So I think it's still a long way. It started somewhere. Yes, if you said some robotic hand has done a surgery, millions of surgeries happen every day. It's still a long way away. I wonder if I'll see it in my lifetime that only robotics, only robots are doing surgeries. I wonder. But even then, AI is. I was just for the sake of this webinar, I was reading up Eric Topol and one of his books. He was saying one of the Stanford University professors in AI says, mind you, it's not AI fully yet. It's human intelligence that is being put into machine learning, and it's and it is stuck together in many ways in a vast scale that is unimaginable for a normal human mind to comprehend. So it's still human intelligence. So whatever you're putting in, it is showing you back. It is giving you back. Of course, there are advanced neural networks which will do internal probably conversations and do a much better job of it. But I think we are still a long way away from bringing AI, let's say, into a remote village in India or Andhra Pradesh or Telangana. So it might come in here and there, but it's not going to replace anybody anytime soon. There are several other issues that need to be sorted out before AI will overwhelm healthcare in every way. Yes, it has started in many sectors, and it is there in our lives in many ways. But if I think that a patient will not at all require to see a doctor shortly, I don't think that's going to happen soon. And also there is this concept that the more the machines take over the world, it should give the gift of time to humans to actually communicate better. So the concept is that if an AI robot is probably doing a surgery, somebody has to reassure the patient that the robot is going to do a good job, and after it gets up, somebody should tell the patient. Another robot might tell it to the patient, but I guess patients still would want to hear from the human touch, somebody telling him, "Don't worry, it's all okay," or something like that. So, and to say that you need the knowledge and experience of a medical practitioner. So it is not going to replace soon enough, but yes, we are heading there, and we have started off, but I think it's going to be a long time away.
I'm sure. I'm sure. There's another question we've got from the audience. So Sheila Evelyn is asking, compared to other countries, where is India in adopting technology in healthcare? Are doctors able to adopt these changes? Is it ethical to use technology in healthcare? So since it is about India, I think Dr. Srilata, you would want to answer that.
So the first part is how much of technology is in India. There is definitely a lot. There are, especially during COVID, we have seen that there's a lot of there are a lot of e-ICUs which have come up. Somebody sitting in Bangalore was treating patients in a remote village in an altitude in Uttarakhand, and then Leh and Ladakh, and they were helping people like that. There is definitely a lot of adoption of digital technology into healthcare. I know definitely in critical care, in terms of tele-ICUs and e-ICUs. Other sectors, I would not be, I have not studied them so much, whether they have adopted. There are certain areas which probably will not be amenable to digital health, like obstetrics, if you take medicine in pregnant mothers and neonates. It's probably not amenable to have a digital tech coming in and helping them, not so much at least. You need obstetrician there. There is definitely a lot of adoption of digital tech into medicine and biomedical professionals. But what I also see that many of the platforms that are built have less number of, I think at least, have less number of doctors involved into building them. So if it's a coordinated effort in building a platform, it's much more user friendly for both patients, doctors, and anybody who is using that particular tech. When only technical people do it, it takes some time to take off. It takes some time for us to adapt. It's not about whether they know that that ecosystem and that technology much better than us. But for the user experience to be good and to be helpful and to be effective, whichever platform I saw which was built with the help of doctors or by doctors being involved a lot in the building or in the architecture of the in helping the tech people build the platform, they have been very successful and they have been very user friendly, rather than I guess some of them make a difference. So yes, there is a lot of adoption of digital tech into medicine. You can see a lot of platforms which people use for taking online consults. There are many vendors now who give online consults. The second question she asked, I think, was about ethical questions. That's a very that calls for a long discussion. That's a very a gray area with many shades of gray in it. But I think as long as we are honest, true to our learning and education and how we treat patients in our daily physical lives, we have to be, as much as possible, we have to be able to mimic that into a digital platform also. When we can't decipher something digitally, then we should be able to tell them that this is not possible. Probably you should see some doctor or nurse who is nearby to you, or somebody who can help you. So ethically, it is now mandatory to adopt digital technology into our lives. Like you cannot ask a COVID patient to from some remote area to travel here to Hyderabad to meet you or something like that. So it is mandatory that we adopt to this. But so the ethics I think will again develop in this ecosystem. People will understand that this is not possible in the digital platform, so we have to probably take it physically. So yeah, it's a very gray area, but
yeah, that was a very detailed and great knowledge sharing from your end, doctor. So thank you for being so generous with it. Ivan, you must have faced similar challenges, I'm sure, while helping your clients who are dealing with day-to-day health issues, maybe with at Wendy's with elderly care and with your present organization. So can you share a bit more about it?
You mean challenges with what specifically?
So like Dr. Srilata said that the development from the tech side also needs some assistance from the doctor's side. So
yeah, definitely.
Probably some simulation studies which you need to carry it out or something like that.
Yeah, but basically having that domain expertise is a basis of project success. So if only tech people want to build a product, especially for healthcare, so it's the biggest chance that would be a failure. Because like especially like even in machine learning projects, on one side that we can think that, wow, it's machine learning, it should adapt and come up with whatever algorithm we want. So we just need to give data and just need to show the labels, the expected output, and that's it. So algorithm will be created on its own, but in reality that's completely different, and you definitely need to have a doctor or domain expert in the field to actually guide you while you're creating machine learning project or whatever digital system you create. So maybe and the impact is it's not really from the user experience standpoint, I would say, but in deep understanding of needs of each user group. So because user experience is more on the technology development side or product development side, but deep understanding of what patient needs, what doctor needs, what nurses needs, that come from people who spend years and years in the industry. So that's and when a project has this combination between technology and with the domain expertise, that create good and high quality products.
Perfect. Thank you so much, Ivan. So we have another question from our audience. How do we see artificial intelligence will be used in e-consultation, primarily in the health sector in future? So John, do you want to take it up?
Yes, it's going to be used in all sorts of ways when it comes down to the consultants area. I think, you know, in some areas we'll be able to get some full diagnosis. You know, I think, you know, the adaption of some machine, clinical based software inside the phones, we'll be able to do it. We're already doing it from wound treatment and things like that here in the UK. So you can take a picture of your phone and it can pre-programmed, it's there to do some diagnosis. But I think, you know, in the long run, something like that would be able to happen a lot. But who knows? Who knows what other technology is going to come around? You know, if we think, I think the biggest barrier for technology in healthcare in the next sort of 10 years is actually the clinicians themselves. And I don't mean that in any disrespect. What I mean is that is actually clinicians getting up to speed with technology and trusting the technology. And I think the trust area is a big area. A lot of our area and our work at Priority is about bringing the clinicians along the journey. At one end, we've got very, very digitally savvy patients who, you know, as we've all discussed, have technology on their phone. We all walk around with a computer that's way more powerful than we've ever had in our pockets before. But actually, the clinicians still haven't bought into this. This is a big change. You know, COVID has accelerated it all around the world. And it's like anything. If you learn to do something in such a rapid period, there's going to still need to be learnings and ongoing changes and other bits and pieces. And I think that's our biggest barrier to moving forward. Artificial intelligence and how that's going to be in the e-consult area, we don't know, because we don't know how the clinicians are going to accept it. It's never going to replace someone. Clinicians may and doctors may become consultants to technology companies, as we all have them. We all have consultants. So they're still going to be there. There's still going to be a role for doctors with inside a technology world, not just from a helping us get better understanding of patient needs and doctor needs in our software packages, etc., and our devices, but those doctors will only get that if they have hands-on treatment with patients. So it's a bit of a catch-22. You need doctors to be, you know, 20, 30 years experience in dealing with patients and have all of that insight in order to provide that to technology companies. Now, if we get rid of the insight, in 20, 30, 40 years, where does the insight come from? You know, the machine learning isn't going to replace doctors. As I've said earlier, I don't believe that we're ever going to have you sat in front of a screen and get diagnosed. You're still going to have, you know, a face-to-face consultation before you go under the knife. Even if robotics comes into play and actually does the surgery for you, there's still going to need to be a human intervention, because at the end of the day, we are social animals. We like to have interaction. We like to be comforted by a friendly face, not a robot looking at us or looking at a screen for diagnostics. So I think it's really, really important that AI will have a role to play. What that role will be, who knows, realistically. But the role of the clinician at any level that we're talking about is as vital as technology moving forward.
That was a perfect answer, John. So, yeah, Dr. Shilda, do you want to add something to this answer?
Yeah, I think he has explained it very well. What you say?
Okay, so yeah, I think she's frozen on us. So meanwhile, we'll just continue. So like you rightly said,
my reading.
Yeah.
Yeah, from my reading that I have understood that there are certain areas where e-consultations are again happening. Like yesterday when Joanna was talking, she was talking about virtual reality in senior living, where they help senior people with many things, including certain diagnostics or certain. So these things are going to happen, but they're not going to replace doctors shortly. But yeah, we have to be prepared for constant evolution and change in our current profession or whatever, in the way we work. We have to be prepared, and we have to keep learning and keep innovating and keep understanding the ecosystem as it evolves. So that's what I feel.
Yes, and while we are all discussing about e-consultation and the treatment platforms or tools to get diagnosed and etc., I also feel there has been surge in preventive healthcare sector as well, because prevention comes even before treatment. And I think even that is somewhere a lot of development has been happening. There are several self-diagnostic tools and gadgets which are coming. Smartwatches can monitor several features of human body. So can you all just share your views about this?
So I think that the biggest, like one of the major sectors we would see impact of machine learning, especially related to e-consultation, is in data analysis and prediction analysis. So basically, when we have all these tools in place, EHR system, telemedicine system, we collect so much data, and the next step is the next question is what we should do with that data. So
Yeah.
and that's where machine learning could be instrumental, where we not only collect and aggregate the data, but we analyze it properly, because as I see it now, very few healthcare organizations understand what to do with the data that they have in terms of predictions, and they all want to do that, especially in the US healthcare system, where everything is shifted to value-based care. They need to understand like how organizations can provide care in a most efficient manner. So that's something where we would see, I think, the biggest impact of these machine learning tools.
Yeah, John, you want to go next?
Yeah, so this is our forte. So preventative medicine is exactly where we sit, but we sit right at the very beginning. So we are in trying to prevent people from getting ill in the first place and needing high-level, highly trained doctors, but actually by dealing with their lifestyle. A lot of our problem at the moment is, especially in the UK, and I know other healthcare systems around the world is exactly the same, is we all deal in the problem at the time, rather than trying to prevent the issue at the very beginning. Type 2 diabetes being a prime example of a preventative issue just by dealing with lifestyle early. And if we can train and relearn as a human race, and I think that is across the board, how to deal with your well-being on a holistic point, again, mental as well as physical, this preventative agenda is really, really key for us, because there's so many issues, cancers, etc., that are all linked to a lifestyle and preventative disease ongoing and escalation. And I think digital, we do it. This is one of our big areas, our priority platform, and our new Amara software and app that's going live next year is all about preventative health. It's all about stopping people smoking, stopping people from being overweight, alcohol, etc., in order to prevent them moving up the scale. And I think that it's a real key. But until that preventative agenda is as important as the physical, cancers and everything else within inside our healthcare system, it's going to be a battle that only technology can answer, because doctors just don't have time. And that's the real problem.
Certainly, I think while we were all focusing majorly on combating with COVID, there has been a huge backlog on surgeries which can be postponed for the moment. Of course, because we have limited resources and limited doctors who can attend to the patients. So with that, Dr. Srilata, I would want to move on to you next.
Regarding prevention, yes. Kudos to people like John who are taking it up so seriously and bringing it to scale in large populations. But my perception of it is that while treatment and diagnosis is sometimes is necessary for the patient, prevention is a choice that people have to adapt to, or they have to make it as a priority in their lives, which is not very easily adopted to by many people. We know ourselves, and many people who we tell them that about smoking or weight or food, or it's a daily, everyday behavioral change that you need to put into your lives, which is extremely difficult. Besides that, I don't know how John manages it with the insurance companies and all there. It's not lucrative, right? It's not GDP friendly. Prevention is not lucrative. So I don't know if people will actually support it. People at higher ups, governments, and I mean, for the sake of it, for saying it, they will definitely do it. But they will definitely, everyone will say prevention, you have to take it forward. But when the wheel really hits the road, will they actually support preventing uh, any chronic illnesses or anything for that matter? But it's a choice that the individual has to make. There are many times, yeah, it's everywhere. I mean, wherever there is um, there is anything that can be that there is an access to tech, there is a chance to incorporate your prevention or diagnosis. Or like the Garmin watch will say, it's time to get up and move. You have been sitting for so long. But it's a choice that the person has to make whether to get up or not, or to stick to Netflix. So it's behavioral change is the most difficult, I feel, to adapt to in any sector for that matter.
That's a perfect answer. And thank you so much, John and Dr. Srilata, for sharing your views on it. So now moving on to the innovation aspect. So there's a lot of research, a lot of work which has been going on, but at the same time, it is important to protect your IP first and then publish it. So what do you think about the protection side of it, protection and enforcement side of it, of the innovations which are happening in health sector? So Dr. Srilata, recently we filed a patent application for you, and so what would be your advice to healthcare startups who are...
again, sorry.
Yeah.
It's very, very important, of course. Patent is like the immediate validation you get for your idea and concept, and it'll accelerate the process of the idea into making a prototype or into bringing it to life. And it's one of the extremely important steps. If you ask me about patenting in healthcare, especially, there are views I heard from experts which said that yes, you do a patent, but it's, if you think about certain vaccines, or there are people who have not, like the polio vaccine was not patented. So certain sectors where there is positive contribution to society in terms of just health. Like a vaccine is, if you take a vaccine, you are just not helping yourself, you are helping the society in general. So in such cases, I guess there is a dilemma whether to actually you may have a patent, whether to actually enforce it into a. So this debate has been going on for so long in the recent months. But otherwise, yes, for products and healthcare tech, I think patent is a life source sometimes.
Yeah, John, would you want to add something?
Yeah, so I think for health techs, and I think especially where doctors and clinicians are involved, they all want to protect their IP. They all want to. This is my intelligence. This is X and Y, and I think that's really, really important. However, not everything can be patented, and not everything can be protected. And actually, sometimes it's a case of you go through all of this. We see it a lot here. We're in Cambridge. There's a lot of software and health solutions that come out, and life science things that come out of the university here, and they take so long to get to market and so much time and effort to get there. But the time they get to market, they're not cost effective, or they're 5, 6, 7, 10 years out of date. So actually, sometimes, and I'm not saying all the time, but sometimes it's really important just to not worry about the protection, get your product to market, because actually getting to market first gives you a certain level of protection and copyright and all those other bits and pieces. And I think, it's important to take advice, and this is obviously, really, really important, but actually, rolling your sleeves up and getting on with it and getting it to the market is equally as important. It shouldn't hold the process up.
Yeah, John, we have another question for you from audience. So Charlotte Rachel is asking this question. I heard John mention his Amara Health app. How can the app work preventatively to make us healthier people?
So the idea of Amara is it's going to work with workplaces to help employers do preventative medicine and therefore increase productivity inside their workforce. So the idea is that actually it's a bit like the doctor was saying earlier, it's a behavior change. It's about teaching and learning and nudging people to make 1%, 2% changes every single day. That's all you need to make. So rather than sitting on Netflix for an hour, go for a walk for 20 minutes and spend 40 minutes on Netflix. You know, we have all adapted and we're all used to behavior change. Behavior change isn't a brand new thing that's come about. It's marketeers have been doing behavior change for their whole life. Every time that you're sold a product, it's behavior change. The fact is, COVID, if we look over COVID and how the response to COVID has been, we've all had to adapt for a number of things, whether it's working from home for the very first time, whether it's doing meetings and conferences like this over Zoom for the very first time. We are all used to making those changes. Sometimes those changes have to be forced upon you, and sometimes they are personal choice and personal ambitions and everything else. But Amara is here, and you know, it's a big product for us. Amara is here to help people along that journey, not to preach, not to say that you're massively overweight, you must lose weight, you must do X, but actually to help them make that 1 or 2% change every single day to achieve what they want at the end of the day. That's the ambition of it. And if that is from an employer's point of view, it's less sick days, it's more production, it's, you know, a healthier, happier, more committed, more retention inside their workforce. If it's an individual or a healthcare scene, it's about that preventative cause. It's about actually taking control of your life and your health and your well-being in order to stop you getting type 2 diabetes, in order to prevent you losing your leg or your sight if you have type 2 diabetes. And I think it's a really important thing that, you know, we have products like this that allow us to do it. One of Amara's biggest points is that it's holistic. It looks at everything from mind, you know, head to toe, all the way through your whole body, what you put in your mouth, what you consume, what you think about and what you do, and as well as physically, that whole physical element, what you do with your body. And that's how it works.
Perfect. So Charlotte, I hope you got your answer, and if you're working, probably your employer should be listening to this. So thanks, John, for those insights. So as we are approaching end of this session, I want to open the yeah, so Charlotte says thanks, that was great. Okay, so yeah, so if you have any question for your co-panelists and you've been thinking about it for some time while I was asking questions, so now is the time to shoot your question to your fellow panelists if you have any. So are there any questions, or we're good to conclude?
So John, how do you how is the take up of this preventive app? How do people take it up? Do they take it up well? Meaning, is there a lot of enthusiasm around prevention?
Yeah, so prevention, obviously, inside the UK is semi-funded by our public health department out of government. So each government has to reduce the health inequalities and increase health inside their population. So we are mainly funded through government contracts, but even still, as you mentioned earlier, it's not at the level that cancer treatment is or surgery treatment is. So it is difficult. Uptake is big. You know, we treat, you know, millions of patients a year. All over the UK, but that's working with some partners. So we don't physically deliver the intervention ourselves. We deliver the software and the marketing and the connection between patient and provider, healthcare provider. But it is difficult. Prevention is a battle. We work with GPs to reduce workload at general practice and primary care in order to ship them through to our services, which then allows those individuals to go on those journeys. But it is difficult. it's an education, it's behavior change. Most of our work is in around behavior change of patient, linking through to software for efficiencies. We're connected directly to all the GP records of inside the UK, and that allows us to remove that need for a GP or an administrator at the general practice to send us medical records or anything else. We're able to do all of that automatically, therefore speeding the process up. But we are, one of our contracts in London, one of our diabetes contracts, we're probably doing 1,000 type 2 diabetes referrals a month at the moment, which is low numbers, but coming out of COVID, it's good, given that we haven't got a lot of face-to-face intervention at the moment. Some of our other services receive smaller numbers, but they're a much more targeted list, maybe the elder population. But it's really important for us that we now move into this space where prevention is key, and actually looking after your whole body and everything else. And workplaces have a role to play with it, with inside their employers. Individuals need to start understanding that actually you are responsible for your body and what you do with it. And it's not just good to know that the NHS is there if I get overweight, the NHS will deal with my type 2 diabetes. If I do X, the NHS will do it. That isn't sustainable, and it isn't sustainable for our government. It isn't sustainable for any country. We need to be promoting and pushing this agenda.
Yeah, I understand that. Yes, that's very right about prevention. And I had a question for Ivan also. Ivan, I wanted to know, how do you manage your data that you get on your platforms, and how is it governed by your government? Do you have any regulations about how, where, at what level you should anonymize, and how much can you allow ads into your apps or tech platforms, or is there anything like that in your system?
So basically, all the data is stored on separate AWS servers, Amazon servers, and in most cases, we follow US-based regulation system, compliance system. It's HIPAA compliant. So because mostly we work with the clients from the US, with companies and startups from the US. It's interesting that even we are now building a telemedicine platform for the Kuwait market, and they also wanted to for us to follow HIPAA compliant procedure for them as well. So that's kind of what we follow, and of course GDPR is used for European projects.
Okay. Do you see? I mean, yes. As you own some digital platforms, probably. I don't know if this is the right question for you, but so when some of the digital companies had approached us in the hospital to put up their monitors on the patients, so they didn't want to take consent directly from the patients for using the data. So it was like the patient didn't know that the data would be in a cloud, Amazon cloud, and it can be used or misused later on. So isn't that a conflict, or is that a concern when we are using digital technologies?
Well, it depends on how you exactly use it. So, for example, if you want to analyze data of your patients, it's obvious that you need to anonymize the data or make the de-identification of the data. You can't use patient information directly. And of course, if companies do that, they violate the patient's privacy. And, that's something that they're not allowed to do. But basically, the way to do it is that you can anonymize data, and then you can divide all your patient database into segments. For example, on behind and use the logic you want to apply, and then you can use the data. So that's usually how you can do it ethically.
Yeah. Thank you. That's it.
Okay, that was very informative, and thanks Ivan, and thanks John for your previous answer. So yeah, so that brings us to the end of this webinar. I want to thank you all for being available, agreeing to come on board with us, and being true givers. You have shared all your expertise and your knowledge with us, and I'm sure the viewers will get a lot of help looking back to this. We have recorded this session and we'll be posting out snippets on social media platform and tag you. So that way we'll be able to reach even a larger audience. So thank you. Thanks, John. Thanks, Dr. Srilata, and thanks, Ivan. And thank you for all and thank you for the audience for making the questions so interesting. So that also helped us a lot. Thank you.
Thanks.
Thanks.
Bye.